The muscles of the back and the neck are the erector spinae, scalenes, sternocleidomastoid, and the splenius capitis. The erector spinae muscle is one of the deepest muscles at the back. Right next to the ribs, it's got 3 strands that envelop the spine, and to me it always looks like a trifid. The origin is at the sacrum, the iliac crest, the last 2 thoracic vertebrae, and the 5 lumbar vertebrae, so at the bottom of the back. Whereas the insertion is the posterior ribs, the cervical and thoracic vertebrae, and the mastoid process at the top. So the action when these muscles shorten is to laterally flex the vertebrae and extend the vertebral column. So as its name suggests, it extends the spine. The scalenes, in my opinion, are a real bread and butter muscle. Sitting just behind the sternocleidomastoid, these muscles attach to the cervical vertebrae and then down onto the first ribs. And when they shorten, your shoulders seem to be pulled up around your ears, and I often feel as though I've just lost my neck when these are really tight. So the origin is C2 to 7, and the insertion is the first and second ribs. And the job of the scalenes is to laterally flex the head on each side, rotate head and neck, and when they both shorten together, they flex the head and bring the chin to the chest. So they are head flexors, and that's the scalenes.
Sternocleidomastoid does exactly what's written on the tin. It attaches to the sternum, the first third of the clavicle, and the mastoid bone behind the ear. The origin is 2 heads, so the manubrium, which is the top of the sternum, and the medial third of the clavicle. The insertion is the mastoid process and the lateral occipital bone. So the action of the sternocleidomastoid is going to be flexion. So when they both shorten, they flex the head, bring it chin to chest. They also laterally flex the head, so that's ear to shoulder, and they rotate the head and neck as well. So that's the sternocleidomastoid.
Splenius capitis is a muscle on the back of the neck that extends the neck predominantly. The origin is the spinous process of C7 to T3, and the insertion is the mastoid process and the occipital bone. So as that muscle shortens from the top to the bottom, the vertebral column extends. It also helps to rotate the head and neck on the same side, and lateral flexion of the head and neck, so ear to shoulder. But its main job is to extend the head and neck. So that's the splenius capitis. Primary muscles of respiration are the diaphragm and the intercostals. All the muscles that attach to the ribs do help with respiration, but these are the 2 main ones. The diaphragm is the main muscle of respiration, and the intercostals assist. The diaphragm is the main muscle of respiration. It sits at the bottom of the rib cage below the lungs and attaches to the lower sternum, the upper 2nd and 3rd lumbar vertebrae, and the lower 6 ribs. And the insertion is through the central tendon. It assists with exhalation, and it increases the space of the thoracic cavity. When the lungs are full, the diaphragm flattens out, and when the lungs empty, it expands to fill the gap. The intercostals are a secondary muscle involved in respiration. The diaphragm's the main one. The intercostals sit in between the ribs, and the origin is the inferior border of the rib above, and the insertion is the superior border of the rib below. They assist in exhalation and decrease the space of the thoracic cavity during exhalation. The muscles of the shoulder joint are the pectoralis major at the front, the deltoid, the latissimus dorsi, the teres major, supraspinatus, infraspinatus, teres minor, subscapularis, and the coracobrachialis. Pectoralis major is the main muscle of the chest. It attaches to the sternum and then goes across to the humerus bone. The medial half of the clavicle is one of the origins, the sternum and the first 1 to 6 rib cartilages. The insertion is the greater tubercle at the humerus, which is on the front. So when this muscle shortens, it brings the arm, the humerus bone, towards the chest. So that is an adduction and a medial rotation of the shoulder. It also assists in elevation of the ribs in forced exhalation. It flexes the arm and horizontally adducts the shoulder. If you go to the gym, it's a good place to learn about the muscle actions, and you'll use a pec deck which exercises the pectoralis major. The deltoid is the muscle that gives shape to the shoulder. You've got anterior fibres, medial fibres, and posterior fibres. The origin is the lateral third of the clavicle, the acromion, and the spine of the scapula. The insertion is the deltoid tuberosity on the humerus, and the action is to abduct, flex, medially and laterally rotate the shoulder, and to extend the shoulder. So for such a small muscle, it actually has quite a lot of actions. Latissimus dorsi is a big butterfly-shaped muscle that gives a lot of support to the arm. Its bulk is on the back, and it comes from the pelvic girdle up through the back and then attaches as a sort of strand around to the front of the humerus. So the origin are the last 6 thoracic vertebrae, the 3rd and 4th ribs, and the thoracolumbar aponeurosis. Now, an aponeurosis, as we've talked about before, is a white sheath of fascia that is very strong and attaches to different parts of the body. So the latissimus dorsi attaches to the thoracolumbar aponeurosis that attaches to the spine, also to the posterior iliac crest. So the insertion is the lesser tubercle of the humerus, which is around the front of the humerus bone. The action is to extend the shoulder, adduct the shoulder, and medially rotate the shoulder. So quite a big muscle, the latissimus dorsi. The teres major is below the teres minor and sits between the lateral side of the scapula and goes across to the humerus. So its origin is the lateral inferior border of the scapula, and the insertion is the lesser tubercle of the humerus. So I don't know whether you can see this or not, but it's going round to the front of the humerus and extending the shoulder, adducting the shoulder, and medially rotating the shoulder. So very similar actions to the latissimus dorsi.
The supraspinatus sits above the infraspinatus in that groove between the spine of scapula and the front of the scapular bone and the clavicle, really. I call it my supermarket muscle, because if you were holding supermarket shopping, you would hold it slightly abducted away from the body. Not so far out that the deltoid medial fibres would kick in, but just far enough to hold a couple of shopping bags. So the supraspinatus fossa is where it sits between that spine of scapula and the clavicle, right on the top of the shoulder, and it inserts onto the greater tubercle of the humerus. So greater tubercle would mean then that it's sat at the back, or on the top really, of the back of the humerus, and that then, when it pulls on the top of the humerus, the arm is going to abduct slightly out to the side. It also is a rotator cuff muscle, so it's going to help the infraspinatus, the subscapularis, to hold that humerus bone in the socket.
The infraspinatus is also a rotator cuff muscle, and it sits in the infraspinatus fossa of the scapula. So there's a little indentation on the scapula which this infraspinatus muscle sits, and the origin is the inferior angle of the scapula, and the insertion is the greater tubercle of the humerus, so it's on the back of the humerus. The action is to laterally rotate the arm outwards, adduct the shoulder, extend the shoulder, and because it's a rotator cuff muscle, it will stabilize the humerus in the socket.
Teres minor goes from the lateral side of the scapula to the back of the humerus, the greater tubercle of the humerus. So when it shortens, it pulls the back of the humerus bone and rotates it outward. So it's a lateral rotation that you get. So the origin is the superior lateral border of the scapula, and the insertion is the greater tubercle of the humerus, so the larger of the bumps on the top of the humerus, so that when it shortens to move, it's going to laterally rotate the shoulder or outwardly move it. And that is an adduction of the shoulder, and it helps to extend the shoulder and stabilize the humerus head and stabilize it in the socket. So the teres minor, lateral rotator of the shoulder, which is the same as the infraspinatus. This one works very much side by side with the infraspinatus, and the infraspinatus would just sit on the top of it, also working at the same time to laterally rotate the shoulder. So I usually remember this, the I in minor reminds me that it's the I in infraspinatus, and they're both the two lateral rotators of the shoulder.
Subscapularis is the fourth rotator cuff muscle. It works very much with the teres major. The subscapularis fossa of the scapula is underneath the scapula, so it forms a sort of scapular sandwich, the infraspinatus. Sub means under, and scapula is under the scapula. The insertion is the lesser tubercle of the humerus, so it's at the front, and when that muscle shortens, it medially rotates the humerus along with the pectoralis major and the latissimus dorsi and the teres major. So it stabilizes the humerus in the socket as well, because it's another rotator cuff muscle. The coracobrachialis sits under the armpit, really. It attaches to the coracoid process, which is a little bony protrusion just underneath the clavicle, and it inserts onto the medial side of the humerus. So its action is to flex the shoulder and adduct the shoulder. So that's coracobrachialis. The other muscles of the shoulder girdle are the trapezius, levator scapula, the rhomboid major, the rhomboid minor, and the serratus anterior.
The trapezius is the most superficial muscles on the shoulders. And in order to get to the muscles underneath, you really do have to work and relax this very thin muscle over the top. It comes all the way up to the back of the head, to that occipital ridge, comes out to the acromion process on the shoulder, comes over the top of the shoulder to the clavicle, follows all the way down the spine of scapula as well as C7 to T12, so covers an enormous area but very thinly. And the problem with the trapezius is if it tightens at the top of the shoulder where the meridian nerves, the median nerve and the brachial nerve come from the neck down the arm, you can often get this impingement as it pulls on the clavicle, on that first third of the clavicle. It can impinge the nerves running from the neck down the arm. So when anybody says to me, I've got pins and needles in my fingers, the first instinct I would have is to really loosen up the trapezius over the clavicle and over the supraspinatus, and then loosen up the supraspinatus underneath, because if both of them are impinging, they can cause tingling and numbness down the fingers. So the origin is the occipital ridge at the back of the head, and the spinous processes, so the last of the cervical ones, C7, all the way down T12, so the whole of the thoracic vertebrae. Then it hooks over the clavicle and the spine of scapula, as well as then out to the top of the arm, which is the acromion process. This has 5 different attachments onto the body, and I-Tech like to ask you difficult muscles. So this is one I can almost guarantee has come up time and time again in the practical as well as in the theory paper. So it's on the back of the head, so it's bound to be extending the head and neck. It also helps with lateral flexion of the head and neck, both sides, so it's bringing the ear down towards the shoulder. That's a lateral flexion. It rotates the head on the opposite side, so turning the head from side to side it helps with. It elevates the scapula, so as it pulls upwards it helps to elevate the scapula, and also it helps to stabilize the scapula as well. So that's the trapezius, a thin muscle but a very important muscle of the shoulders.
The levator scapula sits on the far corner, on the medial corner of the scapula, one either side, and it's exactly what's written on the tin. It levates, it lifts the scapula. The origin is 1 to 4 cervical vertebrae, so C1 to C4, and the insertion is the top medial border of the scapula. So its action is to elevate the scapula, downward rotation of the scapula, lateral flexion of the head, rotation of the head, and extends the head at the back. So the levator scapula sits at the back of the body. Rhomboid minor sits above the rhomboid major, between the spine and the scapula, and it's 2 vertebrae wide. So the spinous process of C7 and T1 is where the rhomboid's origin is, and the upper medial border of the scapula is where it attaches, just below the levator scapula, in fact. The action is to adduct the scapula, to downward rotate the scapula, and to elevate the scapula. So very small muscle above the rhomboid major. The rhomboid major is twice the size of the rhomboid minor and is below the minor. The origin is spinous process T2 to T5, and the insertion is the medial border of the scapula, and its action is the same as the rhomboid minor. It adducts the scapula, downwardly rotates the scapula, and elevates the scapula at the same time. Serratus anterior, as the name suggests, is at the side of the body, slightly more anterior than posterior, and its edge is very much like a sort of serrated edge, like a fingers attaching onto the ribs. It sits underneath the scapula, and its origin is the upper first 8 or 9 ribs, and the insertion is the anterior medial border of the scapula, so under the scapula. So its job is to abduct the scapula, draw the arm forward, depress the scapula and hold the medial part of the scapula against the rib cage. So that's the serratus anterior. The muscles of the upper arm are the biceps brachii, the brachialis, and the triceps brachii. The biceps brachii is the main flexor of the elbow, and it attaches onto that coracoid process where the coracobrachialis inserts, and onto the tubercle of the scapula. And the insertions are the radius and the aponeurosis of the biceps brachii. The action is to flex the elbow, assist in supinating the forearm, and to flex the shoulder. So the word brachii refers to the arm. The brachial nerve, the brachial vein, the brachial artery all supply the arm with blood and with nerve stimulus. The brachialis works with the biceps brachii to flex the elbow, and its origin is the lateral ridge of the humerus, and the insertion is the styloid process of the radius. The action, as well as flexing the elbow, is to assist in the pronation and supination of the forearm.
So the triceps brachii is the proper name for the triceps, often shortened just to triceps itself, but it is triceps brachii, and it has 3 attachments, the triceps, that's where the tri comes from, and the origin is the scapular posterior part of the humerus, which is where the short part of the triceps attaches to, as well as the medial. It inserts into the olecranon process. So those 3 heads, one of them goes across to the lateral scapula, and the other 2, the short and the medial head, attach to the posterior part of the humerus. I used to have a bit more detail in there about where it attaches, but to be fair, it's not entirely necessary. I don't really want to know any more than the scapula and the humerus. The olecranon process is of the ulna, which is the elbow. So olecranon process is the elbow. So it extends the elbow, it extends the shoulder, and it adducts the shoulder. So it takes it in towards the body.
Well, there are lots of muscles of the forearm. You have flexor carpi ulnaris, flexor carpi radialis, pronator teres, palmar longus, flexor digitorum profundus, flexor digitorum superficialis, extensor carpi radialis, brevis and longus, extensor carpi ulnaris and conius, supinator radii brevi, and the brachior radialis. Flexor carpi ulnaris is in the lower arm, in the forearm, on the little finger side. And most of the flexors, well, all the flexors, attach to the medial epicondyle of the humerus. So the origin is the medial epicondyle and also the posterior ulnar shaft. The insertion is the pisiform of the carpal bones. And the action is to flex the wrist, adduct the wrist, and assist to flex the elbow. So that's flexor carpi ulnaris. Flexor carpi radialis also attaches to the medial epicondyle through the common flexor tendon and inserts into the 2nd and 3rd metacarpals. So it crosses over the forearm and goes down the thumb side to the 2nd and 3rd metacarpals. Its action again is to flex the wrist, but this time abduct the wrist, but also assists in flexing the elbow. The pronator teres attaches to the medial epicondyle of the humerus as well as the coronoid process of the ulna. It goes across the forearm, the inside of the elbow, to the medial surface of the radius. And as its name suggests, it pronates the forearm and also assists to flex the elbow. Palmar longus is a really long, thin muscle that comes from the medial epicondyle through that common flexor tendon. It comes down to the retinaculum, which binds the wrist, and also inserts into the palmar aponeurosis. Now, an aponeurosis we know is a white sheath of fascia, very strong, and gives grip and protection to the palm. So the insertion is the flexor retinaculum and the palmar aponeurosis. So it tenses the palmar fascia as one of its actions, flexes the wrist, and also assists in elbow flexion. Flexor digitorum profundus is another long muscle, but attaches to the anterior medial surface of the ulna, and it inserts into the four tendons of the second to fifth phalanges. So its action is to flex second to fifth fingers and also to flex the wrist. The flexor digitorum superficialis attaches to the medial epicondyle of the humerus, the coronoid process of the ulna, the ulnar collateral ligament, and the shaft of radius. It's quite a thick, bulky muscle, and the insertion is into the second to fifth phalanges. So, like the profundus, its job is to flex the second to fifth fingers and flex the wrist. Extensor carpi radialis, this is the longus and the brevis. They're both attached to the lateral epicondyle, as do all the extensor muscles. The insertion for the longus is the second metacarpal, and the brevis is the third metacarpal. They're long, thin muscles that extend the wrist, abduct the wrist, and assist to flex the elbow. Extensor carpi ulnaris, the origin is the common extensor of the lateral epicondyle, and the insertion is on the little finger side, which is the fifth metacarpal. And this extends the wrist and adducts the wrist. Extensor digitorum, again attaching to the lateral epicondyle of the humerus via the common extensor tendon. This attaches to the second to fifth phalanges and extends the second and fifth fingers and assists to extend the wrist as well. The anconeus is a little muscle on the elbow. It's an extensor, so it attaches to the lateral epicondyle of the humerus. It inserts into the olecranon process and the lateral shaft of the ulna, and it extends the elbow. Supinator radii brevi. This attaches to the radial collateral and the annular ligament, as well as the crest of the ulna, and it inserts into the lateral radius, and as the name suggests, its action is to supinate the forearm. Brachioradialis comes from above the elbow on the lateral ridge of the humerus and attaches to the styloid process of the radius, and its action is flexing the elbow and assisting to pronate and supinate the forearm. So the abdominal muscles, anterior and posterior, are the rectus abdominis, internal obliques, external obliques, transverse abdominis, and quadratus lumborum. Rectus abdominis is the six-pack we'd all love to have. Rectus means main man, so it's the main abdominal muscle. It attaches, the origin is the pubic crest and the symphysis pubis, and the insertion is the bottom of the sternum and the 5 to 7 ribs. So when this muscle contracts, it brings the chest down towards the knees. So it flexes the vertebral column. The internal obliques is a very deep muscle. It has quite a few origins: the lateral inguinal ligament, the iliac crest, and the thoracolumbar fascia. The insertion is 9 to 12 ribs and the abdominal aponeurosis, which attaches to the linea alba. The action of the internal obliques is lateral flexion of the vertebrae, rotation of the vertebral column, flexion of the vertebral column, and compression of the viscera. So it's quite a busy little deep muscle. The external obliques are superficial to the internal obliques. They originate on the lower 8 ribs and insert into the front of the iliac crest, so anterior iliac crest, and the abdominal aponeurosis of the linea alba. So linea alba is a sort of central line, which you can see just on this picture on the left-hand side, and the aponeurosis is that flat, firm, protective sheath of fascia. The action is lateral flexion of the vertebral column to rotate the vertebral column, flex it, and compress the viscera. Quadratus lumborum is at the back, just a little bit higher than the waist. The origin is the posterior iliac crest, and it sits like 4 corners on the iliac crest and then inserts into the bottom rib, the 12th rib, and the 1 to 4 of the lumbar vertebrae. The action of it is to laterally tilt the pelvic girdle, lateral flexion. It assists to extend the vertebrae, and it fixes the last rib on inhalation and forced exhalation. So it's a small muscle, and it does depend on the size between your last rib and the top of the pelvic girdle. I've got quite a high waist, so my quadratus lumborum is not actually very big, but a lot of it varies in size. So the hip joint has muscles: the iliacus, the psoas major and minor, the gluteus maximus, the tensor fasciolata, the iliotibial band or tract, gluteus medius, gluteus minimus, the piriformis, and the pectineus. So they are all the muscles in and around the hip joint. So it looks as though we're starting with the hip flexors, and the iliacus and the psoas, the main hip flexors, commonly known as iliopsoas, if the two are discussed together. So the iliacus is, the origin is the anterior iliac crest. These are very difficult to massage because they're really deep and they're on the anterior side of the pelvic girdle. So they insert then into the lesser trochanter of the femur, which means that when we lift the knee up towards our chest, that's a hip flexion, and the iliacus is engaged. It also helps to medially rotate the hip. So another hip flexor is the psoas, silent P. Got psoas major and the psoas minor. The origin of the major is the lumbar vertebrae, and the minor is the first lumbar vertebrae, so it's very thin. The insertion is the lesser trochanter for the major, and the pubic bone is for the minor. So the action of the major is to flex the hip, laterally rotate the hip, and adduct the hip, whereas the minor assists in that lordotic curvature of the spine and helps to tilt the pels posteriorly.
Tensor fasciolata sits right on the side, the lateral side of your hip. So if you get your thumb just inside the posterior iliac crest. That's where your tensor fasciolata starts, and then it inserts into the iliotibial tract or IT band that goes down the side of the leg. The action is to assist with medial rotation of the hip, abduction of the hip, and flexion of the hip. So that's your tensor fasciolata. Repeat after me. Tensor fasciolata.
The iliotibial band or tract, or IT band it's called, goes down the side of the leg, and we can see this in the white band as we come down the side. What happens with the gluteus maximus muscle is it comes across and attaches to the tensor fasciolata and then goes down the iliotibial band below the knee. So the IT band, the origin is the anterior iliac crest, the anterior border of the ilium, and the iliac spine. The insertion is the epicondyle of the femur, lateral patella, and lateral tibia tubercle. So all below the knee for the insertions and up around the hip, the iliac crest, ilium, iliac spine for the origin. So the action is going to be flexion of the hip, abduction, medial rotation, and it stabilizes the knee laterally. So as I said before, the gluteus maximus, this is the biggest of the glute muscles. The origin is the coccyx, sacrum, and iliac crest, posterior iliac crest. And it comes across the back of the buttocks and inserts into the gluteal tuberosity of the humerus, and then goes down the iliotibial tract. So the action of this is extension of the hip, so it raises the trunk out of a chair from a seated position, lateral hip rotation, abduction and adduction. So it's quite a big muscle and it's got lots of action. These gluteus muscles overlap one another. So the gluteus maximus is the most superior, and then underneath, slightly smaller, is the gluteus medius, and underneath that is the gluteus minimus, getting closer to the hip and the head of femur with each muscle. So the origin of the gluteus medius is the ilium of the pelvic girdle. The insertion is the greater trochanter of the femur. Lots of actions though. It adducts the hip, flexes the hip, medial and lateral rotation, and it extends the hip as well. So it's quite a busy little muscle, but smaller than the gluteus maximus. Gluteus minimus, or what I like to call mini-me, is the smallest of the gluteus muscles and the deepest. Its origin again is the ilium underneath the medius. The insertion is the anterior greater trochanter, and the movement is to abduct the hip, medially rotate the hip, and flexion of the hip. Piriformis is a real bread and butter muscle for any therapist. There's a condition called piriformis syndrome, which is quite often diagnosed as sciatica, and it's actually this piriformis pressing on the sciatic nerve, so you get pain going down the back of the leg. But it certainly is responsible for a lot of lower back pain. So the piriformis goes from the anterior sacrum across to the head of femur, and the greater trochanter is where it inserts onto the femur. So the action is lateral hip rotation along with the gluteus maximus and abduction of the hip. The pectineus is a small, tiny little muscle right in the pubic area. So superior pubic bone coming across to the pectineal line, a little sort of ridge in the medial side of the femur. Its action is to adduct the hip, medially rotate the hip, and assist with hip flexion.
muscles of the thigh and knee, there are quite a few of these. The first group are the quadriceps muscles, which are the rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. Then there are the three adductors named after their length. So there's adductor longus, adductor magnus, and adductor brevis, which means short. Then the hamstrings are the biceps femoris, semitendinosus, semimembranosus. And the longest muscle of the body is the sartorius. And another thin, skinny muscle, the gracilis, which is also adductor and other different actions. And they're all the muscles of the thigh and the knee.
The rectus femoris is the main muscle that moves the femur. It's the most superficial of the quads, and it's the only one that goes right the way up onto the pelvic girdle and attaches its origin to the anterior inferior iliac spine. The insertion is the tibial tuberosity, and it attaches through the patellar tendon. So the action of the rectus femoris is to assist in hip flexion and to extend the knee.
The vastus intermedius sits directly underneath the rectus femoris. You might know it's intermedius, it might be intermedialis, vastus intermedialis. These are all tenses of the same word. So in Latin there are 6 tenses to every word, hence iliac, ilium, they're all the same word. This sits right under the rectus femoris, and its origin is the anterior lateral shaft of the femur. It inserts again down the leg and inserts via the patellar tendon into that tuberosity on the tibia. So its insertion is exactly the same as the rectus femoris. But its action, because it only attaches to the femur, top and below, its action is to extend the knee. It does not go as high up as the rectus femoris, so it doesn't flex the hip, it just extends the knee. So that's the vastus intermedius. So the vastus lateralis, as the name pronounces, tells you I'm a big muscle and I'm on the lateral side of the leg. So lateral, we know, is on the side, and in this case it's on the side running from the hip down the outside of the leg down to the bottom of the femur. So the origin for the vastus lateralis is the greater trochanter of the femur, but also the gluteal tuberosity. So it attaches onto the glutes as well at the top of the femur. The insertion is the same as the other quads so far, the tibial tuberosity via the patellar tendon. So it's the same insertion via the patellar tendon into the tibial tuberosity. So the action of the quad muscles is all the same, except for the rectus that flexes the hip. This just extends the knee. Vastus medialis, as the name suggests, says that this is a vast muscle. It attaches medially. So medially means on the inside of the thigh. And the linea aspera. Now the linea aspera is a line. Linea means line, and aspera is a little ridge. So there's a little line and ridge down the femur bone, and this is where the medial lip of the vastus medialis attaches to it. So the origin is this linea aspera, is of the femur, and the insertion again is this patellar tendon onto the tibial tuberosity. The action again, as the same as the other vastus muscles, is to extend the knee. So that's vastus medialis.
So we have 3 adductors, and they're all defined by their length. So brevis is short, magnus is middle-sized, and longus is long. The origin of the brevis muscle is the inferior pubic bone,
and the insertion is the linea aspera on the femur. The action for the brevis then is adducting the hip, medial rotation of the hip, and assisting to flex the hip. The magnus attaches not only to the inferior pubic bone, but also to the ischium and the ischial tuberosity. The insertion for the magnus is the adductor tubercle and the linea aspera of the femur. The action, again with this one, is to adduct the hip, medial rotate the hip, assist in hip flexion, and also to extend the hip. The longus attaches to the pubic bone and comes down to the insertion, again of the same as the magnus, the adductor tubercle and the linea aspera on the femur. So insertion is the femur really. The action again is adducting the hip, so bringing it in towards the body, medial rotation of the hip, assisting to flex the hip. So they are the three adductors. So we're on the back of the leg now, we're on the hamstrings, and the biceps femoris, unlike the rectus femoris, is on the back of the femur. So biceps femoris, it has two heads, two attachments, which is where the word biceps comes from. The origin is the ischial tuberosity, which is your sit bone, and the lateral lip of the linea aspera, which is on the femur. The insertion for the biceps is the head of fibula. The action is to extend the hip, laterally rotate the hip, flex the knee, laterally rotate a flexed knee, and it will cause posterior tilting of the pelvis if it's shortened and it's tight, as I can vouch for, because I have huge problems with tight hamstrings and it affects my lower back by posterior tilting of the pelvis. I have to regularly stretch it to get rid of my lower back pain. Semitendinosus is also a hamstring, like the biceps femoris. It's on the back of the thigh. It attaches to the ischial tuberosity, which is the sit bone. So when we go cycling unexpectedly for any length of time, you can often feel pain in the sit bone. The medial shaft of the tibia is the insertion, which is the other side to the fibula. And the action is to flex the knee, extend the hip, medially rotate a flexed knee, and medial rotate the hip. It also helps to posteriorly tilt the pelvic girdle. So semimembranosus is the last but not least of the hamstrings. It attaches to the ischial tuberosity as well and comes down to the posterior medial condyle of the tibia. So looking at those three, it's only the biceps femoris that comes to the fibula, the other two come to the tibia. The action is to flex the knee, extend the hip, medial rotation of a flexed knee, medial rotation of the hip, and they all posteriorly tilt the pelvis. The sartorius is known as the talus muscle. It's the longest muscle in the body, and the origin is right up on the anterior superior iliac spine of the pelvic girdle, so right up in the hip, and its insertion is the medial shaft of the tibia. So it almost sort of comes down on the right side of your hip, if you're on the right side, and then crosses over and inside and comes down and attaches to the shaft of the tibia. So this means that when it shortens, it can assist to flex the hip, it can abduct the hip into a sort of seated cross-legged position where a tailor used to sit, abduct the hip, lateral rotation of the hip, it flexes the knee, and also it medially rotates a flexed knee. So the sartorius, the talus muscle,
and the longest muscle in the body. So the gracilis is like a taut elastic band. It goes from the pubic bone down to the tibia. So it feels when it's tight like a guitar string or a violin string, and it can be very painful. Footballers often complain of groin strain, and this is often this adductor that causes that. So it goes right up to the inferior pubic bone and the ischium, and it comes down to the medial shaft of the tibia. For such a thin muscle, it's a very busy muscle. It helps to flex the knee, adduct the hip, medial rotation of the hip, medial rotation of a flexed knee. So it's got quite a few actions, and that's the gracilis. So we're on the last leg of the muscles now. Last leg. Lower leg and ankle muscles. The anterior compartment, we've got tibialis anterior, extensor digitorum longus and brevis. The lateral compartment, we have peroneus longus and peroneus brevis. The posterior deep muscles are the tibialis posterior, the flexor digitorum longus, and the popliteus. And the most superficial at the back, the posterior, are the gastrocnemius and the soleus, which attach to the calcaneal bone by the Achilles tendon. The anterior tibialis is the main muscle of the shin. It's the one you get shin splints in, if you've been unfortunate enough to get those. They're quite painful. The origin is the lateral shaft of the tibia, and the insertion is the medial cuneiform and the first metatarsal. So it comes down on the outside, and if you flex your foot, dorsiflex your ankle, you'll see that there's a tendon at the end of the muscle. The muscle forms this tendon that comes down and around and on the inside of the foot. So that attaches then to the medial cuneiform and the first metatarsal, which actually then goes to the big toe. So we're talking about the big toe side. The action then, if you pull on that, is going to be to invert the foot. So that foot is going to come up and out, and the sole's going to be facing and coming up towards us. And it's also going to dorsiflex the ankle. So dorsiflexion and inversion of the foot is the job of the anterior tibialis. So the extensor digitorum longus and brevis, very long muscle, comes down. The origin is the tibia and the fibula. The insertion is the second and fifth metatarsals. So it's coming down the front of the leg and inserting onto the second to fifth metatarsals. So the action for this is to extend the second and fourth toes, to dorsiflex an ankle, which means to bring the toes up towards you. But this time it everts the foot. So it brings the side of the foot upwards. That's the extensor digitorum longus and brevis. So the peroneus brevis is on the outside of the shin. It attaches to the lateral fibula, and then the insertion is the fifth metatarsal. So it goes down the outside of the leg and foot towards the little toe, and the action is to evert the foot. So if it pulled on that little toe, it's going to come up. The outside of the edge of the foot is going to come up, which is an eversion, and it assists in plantar flexion, which is sort of pointing your toes down to the floor. So plantar flexion and eversion. So the peroneus longus is also on the outside of the shin. It attaches and has its origin at the lateral fibula, and the insertion is the first metatarsal. So it goes down the outside of the leg and then under the foot to the first metatarsal. And the action of this muscle is to assist in eversion of the foot and assist in plantar flexion of the ankle. Posterior tibialis is at the back of the leg. It's a deep muscle underneath the gastrocnemius and the soleus. Its posterior shaft of the tibia is where the origin comes from, and the fibula, so tibia and fibula. And the insertion, it comes down the back of the leg, down the side of the calcaneal bone, and then inserts under the foot into the navicular, the cuneiforms, the cuboid, the second to fourth metatarsals. So its main job is to plantarflex the ankle and to invert the foot. So flexor digitorum longus and brevis. So these are under the foot, they're down the back of the leg. The origin is the posterior of the tibia, and the insertion is to the second to fifth metatarsals. The action is to flex the second to fifth toes. And this is plantarflexion of the ankle and inversion of the foot. Popliteus sits at the back of the knee. Its origin is the lateral epicondyle of the femur, and the insertion is the posterior tibia, so the top of the posterior tibia. And the action is medial rotation and flexion of the knee, so that's popliteus. The gastrocnemius sits, it's the fleshy part of the calf muscle, and it attaches to both condyles of the femur, so above the back of the knee, and inserts into the calcaneal bone via the calcaneal tendon, which is called the Achilles tendon. The action is to flex the knee and plantarflex the foot. The soleus or soleus is below the gastrocnemius, attaches to the posterior tibia and fibula, and inserts, like the gastrocnemius, via the calcaneal tendon to the calcaneal bone, and the calcaneal tendon is called the Achilles tendon. And the action is to plantarflex the foot.